Risk evaluation of duodenoscope-associated infections in the Netherlands calls for a heightened awareness of device-related infections, a systematic review. Introduction. Over the years, an increasing number of reports have appeared in the literature describing the risk of patient-to-patient transmission of bacteria by duodenoscopes. These outbreaks were mainly noted and linked to contaminated duodenoscopes through involvement of a multidrug-resistant organism, MDRO, with patients becoming colonized, infected, or dying as a consequence of the infection. Transmission of MDROs through a contaminated medical instrument is considered a preventable event. With duodenoscopy, however, it has become apparent that predictable and adequate decontamination of reusable duodenoscopes is difficult to achieve. In order to determine the extent to which patient-to-patient transmission of bacteria through duodenoscopes contributes to this problem, it is important to understand and scientifically estimate the risk of endoscopy-associated infection, EAI, or more specifically of duodenoscope-associated infection, DAI. For decades, articles and guidelines focusing on transmission of microorganisms through endoscopes cite a report from the American Society for Gastrointestinal Endoscopy, ASGE, published in 1993 by Thieme et al. In this study, it was calculated that 1 in every 1.8 million gastrointestinal endoscopies leads to an EAI. However, 20 years later, Ofsted et al. Argued that this estimate was partly based on erroneous assumptions. Nevertheless, this risk estimate is still often cited in articles, although intuitively it seems to be an underestimation considering the number of reports that have been published worldwide over the past decade concerning the spread of microorganisms from contaminated duodenoscopes. Attempts to establish a more precise and up-to-date risk estimation are fraught with multiple challenges and difficulties. First, the literature reports almost exclusively outbreaks concerning MDROs, which suggests reporting bias. DAIs are exogenous infections as they are caused by microorganisms originating from outside the patient's body, and such infection should be avoided at all times. Endogenous infections are caused by translocation of microorganisms from the patient's own intestinal flora and are an inherent risk of any endoscopic procedure. Moreover, DAIs with sensitive, non-resistant microorganisms are easily mistaken for endogenous infections and are thus rarely linked to a contaminated endoscope. Finally, not all outbreaks with MDROs are published, and a reliable registry or mandatory surveillance system on contaminated endoscopes and transmission to patients is lacking. The aim of the current study was to calculate a scientifically based minimum risk estimate of DAI and duodenoscope-associated colonization, DAC, by analyzing published outbreaks over an 11-year period in the Netherlands. Background: the risk of exogenous infections from endoscopic procedures is often cited as almost negligible. However, this risk is based on older literature and does not seem to match the number of infectious outbreaks due to contaminated duodenoscopes reported after ERCP. Using Dutch data, Kwakman et al. Aimed to estimate the minimum risk of DAI and DAC in patients undergoing ERCP. Methods: a systematic literature search identified all DAI outbreaks in the Netherlands reported between 2008 and 2019. Included cases were confirmed by molecular matching of patients and duodenoscope cultures. Risk ratios were calculated based on the total number of ERCPs performed during the study period. Results: 3 outbreaks were reported and published between 2008 and 2018, including 21 confirmed DAI cases and 52 confirmed DAC cases. The estimated number of ERCPs performed during the same period was 181,209 to 227,006. The calculated minimum estimated DAI risk was approximately 0.01%, and the minimum estimated DAC risk was 0.023% to 0.029%. Conclusions: the estimated risk of DAI in Dutch ERCP practice was at least 180 times higher than previously published risk estimates. The actual risk is likely to be much higher due to underreporting of infections caused by multidrug-resistant organisms and sensitive bacteria. Greater awareness by healthcare personnel involved in endoscopy and endoscope cleaning is required, as well as innovative technical solutions to contain and ultimately eliminate DAIs.